MD. My specialty is gynecology, and I'll be at the Bethlehem campus on Highland. Originally it was obstetrics and gynecology. It was able to furnish the joy of delivering babies, the joy of helping people create babies, and 6,000 babies later we decided that that could be stopped right now. Starting in 1990, I actually brought minimally invasive surgery and gynecology to the Lehigh Valley, having started with laparoscopic hysterectomies, laparoscopic ovarian removal, ovarian cyst removal, treatment of endometriosis, and then gynecology with surgery, non-surgical methods. It was just a wonderful, wonderful mix of everything. Education, originally Muhlenberg College, followed by University of Pennsylvania School of Medicine, Pennsylvania Hospital for residency training. Coordinated health has given the opportunity for those of us doing these specialties to pursue the real needs of people, the real interests that people have in taking care of their day-to-day needs, whether it's physical with orthopedics or in my specialty, gynecology, the real needs that people have. What we want to do is, if there's a problem, to work on it and correct it before it becomes a major problem. But in addition, we talk about diet, vitamin therapy, exercise, full range of gynecologic conditions, but with a special interest in menopausal medicine, endometrial ablation, non-invasive tubal sterilization procedures, and minimally invasive surgery for ovaries, endometriosis, and uterine abnormalities, and all of the things that are necessary to have a healthy life in the future. There are several ways of doing tubal sterilization, traditionally using the laparoscope, which is through the belly button, and putting rings around the tubes or burning the tubes. It's a very standard, very wonderful way of doing it. There's a new technology called Adiana that allows me to use a telescope through the opening of the cervix into the uterus, putting actually plugs in the tube at the opening to the uterus. And again, 10 minutes later, a patient gets up, walks out, and the very next day is back to normal activity. I have outside interests in photography, in travel. I have a son in Germany, a son in Texas. We get to go a lot of places in the world. We have grandchildren, and then of course we've been doing research on the NovaSure procedure. NovaSure is one of the methodologies of doing endometrial ablation, destroying the lining of the uterus, and what we want to do is to prove the safety and efficacy of this in our community. Oh, I've seen the Lehigh Valley grow up from a small community of 3 individual cities now to a metropolis that has everything to offer. And the best thing it has to offer is that I can get to Philadelphia and to New York and use those cultural experiences and come back and live in the Lehigh Valley. Menopausal medicine is more than just taking care of menopausal symptoms. When women reach the age of menopause, there are many things that we must think in planning, because a woman who reaches today the age of 50, who does not have cancer or heart disease, her life expectancy today is age 93. So what we have to do is plan a base that allows women to approach age 93 and perhaps past, healthy in brain, healthy in body, healthy in spirit, so that they could be productive for themselves well into the future. I am what I am. I have a lot of experience. I have understanding of people. I don't want to make that gender specific. People, we're all people. Well, a perfect day was defined a long time ago as a doctor is a person who's trying to put himself or herself out of business. So the perfect day would be when I'm no longer needed.